Hello guys, and welcome back to another video of Just Floss It. Today we're going to be talking about periodontal disease. What is periodontal disease? Well, if you watched my What is Gingivitis, then you'll kind of have an idea of what gum disease is. Now, if you haven't seen that video, I'll go ahead and link it down in the description so you can go ahead and watch that so you can have a further understanding of what today's video is going to be about. Now, what is periodontal disease? Periodontal disease is a gum infection and the tooth structure around the gums. So what does that mean? What is gum infection, gum disease? Well, gum disease is bacteria that sits on your gums that causes first phase, which is gingivitis. And with gingivitis, your gums are swelling away from your teeth. A lot of people, a lot of my patients at least, they think that the gums swell onto the teeth. It's the exact opposite. So the gums swell away, allowing bacteria to come in and sit in an area that you can no longer brush or floss off. So then if gingivitis turns into the next phase, which is periodontal disease, that's when you start losing bone and gum structure. Once you lose bone and gum structure, you cannot go back from that. You cannot regrow the bone. You cannot regrow the gum tissue. So it's very important to know where you stand, how healthy your bone level is when you visit your dentist. Between the ages of 18 and above, your hygienist starts taking some measurements of your gums. And these measurements determine how healthy your gums are and how healthy your bone level is inside your mouth. Because with periodontal disease, it wears at the jaw. So what happens is if it's a severe case, at that point your teeth are really loose and you hardly have any bone remaining in your mouth. And what do you do at that phase? You would have to extract the teeth. So it's very important to know what is periodontal disease before you get to a point where you cannot return at all. So when they take those measurements, it'll determine what kind of cleaning you need, also what kind of gum health that you have. So with periodontal disease, it's very important to know that it's not just your gums and your teeth being affected. A lot of my patients, they start to think, oh, well, if I start losing my teeth, it's okay. If you lose your teeth, you're going to end up with some sort of partial or a denture, which are okay with some patients, but overall, it does not replace what a healthy tooth would be. So if we could prevent that from happening, then better. With periodontal disease, I like to refer with my patients that it's kind of like having a plant. I like to use that as an example. So a plant has soil, and normally you have the soil at a certain level. Well, if you start breaking the soil down, then the plant slowly starts to become wiggly. And when you take out enough soil from the pot, then the plant completely dies. It's the same concept with your teeth. If you are losing bone at a rapid rate, eventually your tooth is going to be loose and have to come out or will fall out on its own. So it's very important to prevent that from happening entirely. Also, the periodontal disease is closely connected with the body. So what do I mean by that? If you have gum disease present inside your mouth, you are swallowing that bad bacteria each and every single day, and it's entering your system. And so what happens is periodontal disease is linked with cardiac disease. And cardiac disease is when people have heart attacks or something's going wrong with their heart. So if you have something wrong inside your mouth, it's actually connected to your body as well, and it could even cause dementia. So it's very important that if you're told at an appointment that you have periodontal disease, that you take the right steps forward to preventing yourself from progressing with the bone loss. Now, how do you progress with the bone loss? Well, it depends on what phase of gum loss and bone loss that you have, that your dentist will discuss with you whether it's important that you need a deep cleaning, or in some cases, if it's very severe, you might need some work like bone grafting and gum tissue grafting. It depends on what phase that you land in, and that all goes back to the numbers that they take from year 18 moving forward. Your hygienist starts taking some measurements of your gums. So those measurements at every appointment are very, very, very important to your health and kind of understanding where your body stands when it comes to how healthy your gums are, how healthy your bone level is. That is all I have for today, guys. I hope you guys liked this video, and if you guys did, be sure and give it a like, and we'll see you guys in the next video.